In today's Our Town coverage of Acres Homes, we are looking at health issues many people in the area have to deal with.
Our health reporter Haley Hernandez is here to explain the struggles and the unique effort to bring some change. Haley?
Yeah, because, despite being the largest medical center in the world here in Houston, Houston still has healthcare deserts all around us. And people in communities like Acres Homes don't have access to basic health information. Now, while that can lead to dangerous complications like cancer, MD Anderson tells me that a lot of it is derived from metabolic issues. In Acres Homes, 46% of the population is obese, and that compares to about 38% in Houston. But helping to improve the health of these neighborhoods really has a big impact on all of us.
We know this is a scary topic, but you're not in this alone.
This is the message Rain Eatman wants her fellow neighbors in Acres Homes to hear.
Have you known people who have had diabetes?
Yes.
High blood pressure?
Yes.
Obesity? Cancer?
Cancer, yes.
Asthma?
Asthma, yes.
COPD?
Yes. Yeah. Because when you look at a community as underserved as Acres Homes, it has been a long time of lack of resources, lack of information, siloed information that has made it harder for residents to get access to things that have been openly free for the vast majority of the city of Houston.
One organization noticing the need for change, MD Anderson.
We're really interested in ways to make improvements to help people be more physically active, to help them eat a healthier diet, to have access to healthy food so they could do that.
Dr. Karen Basin-Enquist leads the MD Anderson Be Well Communities project in Acres Homes. The program installs workout equipment, local gardens with fresh food, and sometimes sidewalks to make the neighborhood a healthier and safer place to work out. And Eatman helps make sure that people use it, plus provides feedback on things that her neighbors actually want.
They really wanted to make sure that when they approached this community, it was really for the community and by the community.
We know that diseases like cancer, like diabetes, like heart disease, they're often called lifestyle behaviors, but they're also really influenced by the communities that we live in.
And if you think this doesn't affect you, like you don't have health problems or maybe you live far away, think again.
If we wait to act until after somebody has a disease, it's tremendously more expensive than putting in sidewalks and playgrounds and gardens and making sure people have healthy food. So we need to consider the impact that prevention can have on our, healthcare economy.
For people like Rain, who grew up in Acres Homes with asthma, it was a vicious cycle that she couldn't safely exercise, but without exercise, it led to further health complications. So that's why she's taking a strong stance now, hanging on tight to people like Dr. Basin-Enquist, who is willing to help, and pulling everyone else on track with her.
When you try to tackle them all at once as an individual, it does become debilitating. But then you have trusted community partners to say, hey, we don't have to go to the extreme. We can start by incorporating you in a walking group every day. We go every day, just walk with us for a little bit.
So I also asked Rain if there were other health needs that are being neglected in the community, and she says that people there have anxiety that's often a generational problem, passed down from one generation to the next. You can hear more about that coming up on KPRC2 Plus in just a few minutes.
Interesting. Yeah.
But yeah, that preventative medicine really helps to save us all money. Like MD Anderson saying, it's cheaper for us to come in here and put in sidewalks so people can exercise than to treat their cancer later.
Yeah, and I love that group every day. She says, I get out there every day, step by step.
They do, and they've got dance classes at the Acres Homes Multi-Service Center. They're doing a lot.
It's real community right there.
Yeah, because MD Anderson also asked them, what will you do? It wasn't just like, here, we'll give you all of these fitness classes. They said, we like to dance, we like to walk, we like to do these things. And so now they're actually doing it because it's stuff they like to do.
When you enjoy it, it's so much better. Thanks, Haley.